Lower the leg back down. Use the edges of the stones to massage around the back of the ankle, the Achilles tendon. And then use the edge of one of your stones just to massage deeply into the sole of the foot. And then with a corkscrew motion, just press the edge of the stone deeply into the sole of the foot. Again, using the flat of the stone, helps to stretch out the back of the tendon that extends across the bottom of the foot. And then use both of your stones to trace back up the legs and back down again. And just fade the movements away just by using the edge of the stone to trace down the leg and off the bottom of the foot. Now you're anchoring stones at this point. Stones can be placed. My anchoring stones are also here in the sacral area. I'm going to place one of these stones just underneath the side of the hip there, Fran. And the other one I'm just going to place under the leg there, just above the knee, obviously not over the kneecap itself. Does that one feel comfortable, Fran? And then we're going to repeat that sequence on the other leg. So using the palm stones, we're going to come, using the flat of the stone, going to come up, back of the calf, round, down the thigh, turn your stones over, and using the edges of the stones perform a petrissage movement, back of the calf, into the back of the thighs, sweep back down again. And then using one supporting stone at one side of the hip, going to massage the edge of the other stone into the inner part of the back of the thigh and then across the back of the hamstrings. And swap your supporting stone to the inside. Massage up the back and the edges of the hip. And using the flat of the stones, we're going to pull from the sides to the centre, up and down. and using the edges of the stone over one another, as if simulating a kneading or petrissage movement. Progressing down to the back of the calf. Take one stone, support, drain down with the flat of the stone, and then use the edges of the stone and the back of the Achilles. And then use the flat of the stone into the sole of the foot, and then use the edges of the stone to perform a corkscrew movement into the sole of the foot. And taking both stones, we're going to trace back up the leg, down again, using the edges of the stone just to trace down and fading off the bottom of the foot. And our stone placement here, one stone gets placed at the side of the hip, so the top of the side of the upper leg, and then the other stone can be placed just above the knee. And that concludes the back of the leg sequence. Before you help your client to turn over, you need to ensure that you take off your gemstones and also the anchoring stones, which are here in the lower back, sides of the hip, and underneath the front of the shoulder, and also underneath just above the knee. So with the client now turned over, before the client then lies back down again, we're going to place some stones in place so that the client lies back onto them. So two of the larger stones are going to be placed here at the lower back. So the important thing here is just to trace down the client's back and try and get those in position. And then the other two, according to how long obviously the client's back is, are going to be placed under the top of the trapezius. So before we get the client to lie back onto there, we're just going to cover those stones over and then ask your client to then gently lie back onto the stones. And just check that they're in the right position before you start. Are they comfortable for you there, Fran?
Yes, they are, thank you.
Okay. If they're not comfortable, then obviously reposition them before you start your treatment. With the client turned over and the stones safely in place, we're going to commence on the front of the legs, on the front of the body. So taking two of the large stroke medium-sized palm stones, we're going to start off either side of the lower leg, just taking care not to press on the tibia shaft because it's not very supported by tissue. And then you're going to come up to the thigh and then sweep back down again. So using the flat of the stone first to simulate an effleurage movement, and using the edges of the stone, coming up the sides of the lower leg, up to the thigh, let the stone press into the muscle, sweep back down again. Take your supporting stone one side, then use the edges of the stone to massage into the inner part of the thigh, across the adductor muscles, and then across the quadriceps and the front of the thigh. Change your supporting stone to the inside, and then trace the edge of the stone up the side of the thigh and up to the side of the hip. Then, using the flat of the stone, lift up the sides to the centre. Come down to the knee, using the edges of the stone, trace round the knee. Taking care not to press on the bone itself. And then trace down to the Achilles, just massage around the back of the Achilles, and then we change to smaller stones for the feet. So using the smaller stones now, we're going to trace in between the metatarsal spaces across the top of the foot. And then leaving one stone in between the big toe and the second toe, we're going to use the other stone to press into the sole of the foot. So use the flat of the stone first. Then use the edge of the stone with a corkscrew movement into the sole. Starting from the solar plexus reflex. Then back to the flat of the stone, coming up, just tracing up the thigh, back down again, just to indicate that that part is coming to a close. Just trace your stones down gently. And the placements here can be the side of the hip. So place those stones comfortably at the side of the hip for your client. And then we're going to repeat those techniques on the other leg. So first of all, using the flat of the stone, starting either side of the lower leg, avoiding the tibia shaft, and then up to the thigh, sweeping back down again. Remember, just keep pressing the stone into the muscle, effortless as far as the therapist is concerned. Then using the edges of your stone, tracing them up the outside of the lower leg, up to the thigh, sweeping back down again. And then coming up to the thigh, I'm going to use one supporting stone at the side of the thigh and use the edge of the other stone to massage in to the inner thigh, the adductor muscles. And across the quadriceps. And change your supporting stone so that you then trace up the outside of the thigh and up to the side of the hip. Use the flat of the stone to lift from the sides to the centre. And then down to the knee, so use the edge of the stone to trace round. Then down to the Achilles. At this point we're going to change to our smaller stones. We're going to go in between the metatarsal spaces of the feet. Using the edges of the stones. And then tuck one of the stones in between the big toe and the second toe, and then use the flat of the stone into the sole of the foot. and then use the edges of the stone to work like a corkscrew movement into the sole of the foot. And then back to just trace up the leg once more with your larger stones. And then just tracing the edges of the stone down and gradually fading away. At the end of the treatment, you can place the stones under the sides of the hip. And that concludes our treatment to the front of the legs. So although we don't actually massage directly over the abdominal area with the stones, we're going to place one of the larger stones, an anchoring stone, just above the pubic area, and then we're going to place another stone just under the rib cage in the solar plexus region. But before we actually place that stone, we're just going to massage just in the solar plexus area, just in a clockwise direction, and then an anti-clockwise direction over the solar plexus, just to help to balance the client, and then just leave those stones resting in that area. So starting the hand and arm massage with two of the palm stones, use the flat of the stones, trace up the arm, around the cap of the shoulder and back down, just to introduce the stones to the client's arms. And then we're going to set one of the stones into the client's palm, which we'll be supporting, and use the other stone, the edge of the other stone, to trace up around the cap of the shoulder and back down again. So simulating an effleurage movement with the flat of the stone first, and then up the inside, and then use the edges of the stone to the upper arm, trace round the cap of the shoulder